Good.
Okay. So our topic was exercise-induced asthma. I'm Michaela.
I'm Kevin.
I'm Francesca.
I'm Gia.
I'm Jessica. So for the etiology, exercise-induced asthma is also known as exercise-induced bronchoconstriction or exercise-induced bronchospasm. It's characterized by aerobic physical activity, increased training load, and or inhalation of cool, dry air. It triggers respiratory anguish, which is difficulty in breathing. It can result in coughing, tightening of the chest, wheezing, shortness of breath, unusual fatigue during or after exercise. And it can occur in individuals that already have chronic asthma or if individuals without chronic asthma. It's somewhat unclear, but the most common theory is that it happens due to heat loss, water loss, or a combination of both, or hyperventilation due to intense
Bless you.
exercise. It usually occurs about 5 to 10 minutes after the initial exercise and then subsides within an hour.
Some obvious signs and symptoms are wheezing, difficulty breathing, chest tightness, coughing, problems with prolonged sessions of exercise. Some subtle signs and symptoms that you might not think of are stomach pain, fatigue, inability to exercise in the cold, chest congestion, frequent colds, dry throat, and headache.
In many cases, exercise-induced asthma can be misdiagnosed by either overdiagnosing it or underdiagnosing it. There's two main tests to test for it, direct and indirect. Direct tests consist of a pharmacological test. It activates the direct contraction of smooth muscle in a person's airways through medication or a drug. And then indirect activates muscle constriction, mimicking an incident on a sports field. Indirect tests are the tests that's more effective for exercise-induced asthma. They act to recreate a specific physical exercise either on the field or in the lab, so they can be specific to a certain type of sport. Examples of them are just physical tests, eucoponic voluntary hypernia challenge tests, and osmotic challenge tests. Treadmill tests assess the number of bronchospasms that a person is having, and then an echocardiogram can also be used to assess any cardiac abnormalities. It's very important that the physician or whoever is seeing the patient runs the test and doesn't just rely on information from the athlete, because oftentimes the athlete will deny having any symptoms due to peer pressure or fear of losing their spot or starting spot on a team, and they don't want to look weak to their teammates.
For treatment and proper management, the best way to manage exercise-induced asthma is to prevent it and treat it. Taking certain dietary precautions and completing a good pre-exercise warm-up and cool-down will really aid in managing this, because instead of just jumping right into the sport or activity that you're doing, it's good to acclimate your body into slowly easing into the sport and slowly cooling down. For treating exercise-induced asthma, it's been found that certain fish oils, vitamin D, short-acting beta-2 agonists, and inhaled corticosteroids have worked the best. And short-acting beta-2 agonists are available in an inhaled form, pill, liquid, or injectable, and the most common is inhaled. And the two that the Medical Commission of the International Olympic Committee allowed for athletes to use were salbutamol and terbutaline, and both of those, like any other inhaled beta-2 agonist, you need a prescription by your physician. And what they do is they relax the muscle lining the airways that carry air to your lungs, and they happen pretty quick. The medicine goes into your system within 5 minutes, and it can last from 3 to 6 hours. And inhaled corticosteroids are just long-acting beta-2 agonists, and they just take a longer time to get into your system. It takes about 30 minutes to get into your system, but it also lasts a lot longer. It could last up to 12 hours. But it's very important to take both, whatever one you're taking, it's very important to take prior to participating in sports. That way it could just get into your system before you start doing any exercise or activity.
For return to play, the athlete can return to their sport when their symptoms are completely gone. And if the symptoms reoccur, whoever's managing the athlete should follow their action plan. And an action plan is I have one, it's on a piece of paper, and it's like a red, white, green light and yellow light, and it tells whoever what medicines you have to take at what level you're at, and how you feel and whatever. Before the athlete returns to play, they should be evaluated by a physician. There's no specific return to play guidelines to athletes who have an asthma attack. The athlete should just be symptom-free and start with low activity and gradually build up. And the athlete's lung function should be monitored with a peak flow meter, and the reading should be compared to the baseline from prior to entering the sport. A peak flow meter is, I don't know if anyone has seen it, but it's the thing where you blow into and it tells you your how much air you have in your lungs or whatever.
The effects on the athlete, like we said before, the signs and symptoms would be shortness of breath, chest tightness, wheezing, decreased performance, and coughing. And an athlete should use they can use an inhaler that contains albuterol. This will lessen or even prevent exercise-induced asthma. Some sports that the athlete should do are short duration and the periodic periods of exercise. So these sports would be softball or baseball, volleyball, football, golf, wrestling, any one that you only are able to, like the short durations, so they are able to relax after a few seconds. Some of the sports that have the longer durations of exertion or are more detrimental to the athlete, so this would be soccer, basketball, long distance running, hockey, skiing, and skating. They don't have that much resting period, so you have to, it would be worse for them. Also, the temperatures, like certain temperatures, which are the colder weather, would be worse for the athlete too. Some of the precautions, the athlete shouldn't stop working out if they have it. They should just take it slow and ease up to where they can go to their full potential. And they should never try to overexert themselves. When athletes are outside in like the cold, they should cover their nose and mouth. And the most ideal place to exercise is in a humidified, warm environment. The athlete should warm up and cool down completely whenever they exercise or play, and this will help them with exercise-induced asthma. Some other precautions, with the proper precautions, an athlete with exercise-induced asthma can complete to their fullest. And these are our references.